Friends, today I will talk about the pseudo-resistant hypertension. First is a disclaimer. Caring Docs YouTube channel does not provide medical advice and information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. Friends, resistant hypertension means the blood pressure remains high despite using 3 different antihypertensive drugs, including a diuretic. It increases the risk of heart attack, stroke, kidney disease, and healthcare burden. The pseudo-resistant hypertension looks like resistant hypertension, but the cause is not true drug resistance. It may be due to wrong BP measurements, white coat effect, poor drug adherence, or clinical inertia. As we know that resistant hypertension, as I already told, that despite giving 3 drugs including diuretics in their optimal dose, still the blood pressure of the person is not controlled. This is a resistant hypertension. It is seen in 10 to 20% of the patients, and it carries 50% higher cardiovascular risk. It requires lifestyle changes, drug optimization, and we have to rule out the secondary causes. So, the causes of pseudo-resistant hypertensions are inaccurate BP measurements, white coat hypertension, poor adherence, or clinical inertia. The common measurements errors are: if we don't let the patient to rest 5 minutes before taking the BP readings, if we take the single reading instead of average of 3 readings, if we use wrong cuff size or position, if the patient just has smoked or taken caffeine and we are measuring his blood pressure, if the arm and feet are not positioned properly, or the device which we are using it is not properly validated, and the cuff deflation is too fast or too slow, there can be observer bias, auscultatory gap also. So the faulty measurements alone can overestimate resistant hypertension by 30%. White coat hypertension, it is high blood pressure in the clinic but normal at home. It is seen in 15 to 50% of the cases. It needs to be differentiated from transient white coat effect. Clinical inertia is when doctors avoid intensifying the therapy despite uncontrolled blood pressure. For example, underuse of chlorthalidone, which is seen in less than 5% of the population, and spironolactone, seen in less than 20% of the patients. Medication non-adherence, it is very common. Causes are multiple pills, side effects, cost, lack of education. So the solution for this is patient education, single pill combinations, and addressing the barriers. So pseudo-resistant hypertension is often due to errors, and it is not a true drug resistant. Careful evaluation, proper BP monitoring, and patient-centered management can improve the outcomes and prevent unnecessary treatment. Medicine is a science of uncertainty and art of probability. It was said by William Osler. So with this, I conclude my today's topic. Thank you. Keep learning.